All right, guys, so in this module, I am working on a project. I'm helping some of the members from my zero to paid Medicare billing group develop their offer that is a hybrid offer combining covered services and non-covered services. So let me show you, first let me show you the document. I'm going to zoom in here just a little bit so you guys can see it a little better. So something like this, right? You guys can see on the screen behind me, the following interventions have been recommended to treat your condition. This is something that's going to go to the client, to the patient. Restorative massage. Now, that's a term that I like using. There's no limit to the number of kinds of massages that are out there. You'll receive this treatment from a PT, PTA, or LMT. This treatment will include soft tissue mobilization and massage. People don't know what soft tissue mobilization is. This treatment will be delivered in our physical therapy gym because I want the beneficiary to understand that this isn't something that's going to be delivered in a room, dark room, weird music with a stranger. Like, we're going to be out in the gym, we're going to be in the open, you can see here in the therapy gym, and will be provided over the clothing while you're comfortably seated in a chair or lying on a mat table. I think there's a massive, huge, enormous demographic of clients who respond positively to manual therapy, but they don't want what they think it's going to be, right? They don't want to go into a private room. They don't want to take their clothes off. They don't want to lay down on a table. So this is giving them a chance to say, okay, I understand. This is going to be done out in the gym in public. It's going to be done over the clothing. It's going to be done seated in a chair, maybe laying on a table. Then asterisk, restorative massage is not medically necessary for your condition and therefore is not a covered service on the Medicare Part B benefits. This was established during the evaluation at the plan of care, right? And so what we're doing is we're creating something of a menu. There's going to be a pricing list associated with this. So for us, restorative massage is basically sold in $25 15-minute increments. And as I said, it could be a PT, PTA, PT, PTA, LMT in our practice, because I want the freedom, the flexibility to be able to have different providers render the service, but it's a self-pay service. So let me show you, going back into CMS guidelines, this is an old, outdated LCD, but there's valuable information in this. So this is information about therapeutic exercise. What I do is I'm going to come down, I'm going to pull up some information on massage. So right here, massage therapy, including effleurage, petrissage, build again in 15-minute increments. Massage may be medically necessary as adjunctive treatment to another therapeutic procedure on the same day, which is designed to reduce edema, improve joint motion, or relieve muscle spasm. Now, I know you guys are looking at that and you're saying, well, that tells me it's a covered service. But the question is it medically necessary? And that's where your skills as a therapist, as an evaluating therapist, are going to come into play. Massage is not covered as an isolated treatment. That right there opens the door for you to provide massage therapy, manual massage therapy on a, a la carte basis. So a patient, maybe they've been discharged from formal therapy, but they just have a tweaked neck, they have a sore shoulder, they just want to come in 15, 30 minutes, they want you to work on them. Only manual. They're already doing their exercise, right? They're already going to the gym, they're doing all the other stuff. You've determined that as long as they're doing their other stuff independently, they can do it safely, but they can't do massage to themselves. So now this line right here opens the door as allowing you to provide massage as an only isolated treatment on a particular session, and it's not a covered service. That means it's available for cash pay. Documentation clearly support the need for continued massage beyond 6 to 8 visits. If you guys watched the other video, I'll post the card up above for the video that showed Medicare did 122 randomly selected claims that included 97124, and it was 93% were denied for various reasons. But anyway, this is not covered on same visits as 97140, manual therapy, supportive documentation, areas being treated, objective findings such as measurements of range of motion, subjective findings including pain location, effect on motion. So like I said, it's one of those things that we know based on these guidelines if massage is the only treatment rendered on a session, it's not covered. That means it's a self-pay benefit to the Medicare beneficiary. If you determine during the evaluation massage is not medically necessary, then it's not covered. If you determine that massage is medically necessary initially, but then after 2 or 3 treatments it's no longer medically necessary, they can have the option to pay for it out of pocket, right? So we've got 3 scenarios on how massage can be incorporated into a hybrid practice model where you're providing both covered and non-covered services within an individual session. Guys, if this kind of information helps you build your practice, helps you understand what you can do and what you can't do, do me a favor, post that comment in the comments below on YouTube and subscribe to the channel. The more subscribers we get, the more content I can provide for you guys. And the more questions I get, the better content I can provide for you. Guys, I'll catch you on the next video. Thanks so much for watching.